You're listening to the Unlocking Africa podcast.
We, the Brazzaville Foundation, founded by Jean-Yves Olivier, are really preoccupied by these things because these things on the ground are killings. In the world, when they catch somebody with drugs, it cuts you at least 2 years jail. You do the same with thousands of dollars of fake medicines, it just costs you 6 months jail. We hope that this is one of the initiatives that can help Africa to strengthen the health system professionals on the ground.
Stay tuned as we bring you inspiring people who are unlocking Africa's economic potential. You're listening to the Unlocking Africa podcast with your host, Tessa Adamu.
Welcome to another episode of the Unlocking Africa podcast, where we explore the ideas, innovations, and strategies that are unlocking Africa's economic potential. Fake and falsified medicines are one of the most dangerous yet least visible threats to Africa's public health and economic resilience. Today, I'm joined by Foulo Basse, CEO of the Brazzaville Foundation, an organization working at the front line of Africa's fight against the trafficking of falsified medicines. From policy reform and cross-border cooperation to underground pilot programs, Foulo and his team are focused on turning political commitment into real-world impact. In this episode, we'll explore why falsified medicines are not just a health issue, but a trade, security, and economic challenge. Foulo, welcome to the Unlocking Africa podcast. How are you?
I'm doing excellent. Thank you very much for having me. Thank you for this opportunity.
As always, I like to start from the beginning and get straight into things. So let's start by grounding listeners in the reality of what's actually happening. So Cameroon recently announced seizure of counterfeit medicines worth hundreds of millions. We know that also billions have been confiscated since 2020. From your vantage point, what does this tell us about the scale of the problem versus how much we're actually stopping it?
You may allow me to introduce this very important thing. We, the Brazzaville Foundation, founded by a guy called Jean-Yves Olivier, we are really preoccupied by these things because these things on the ground are killings. Let me share some figures with you. In the worldwide system, you have 1 million of deaths per year, mainly in Africa, but in the worldwide system. To figure out how big is the issue, if you take the traffic of guns plus traffic of drugs worldwide, financially it is under what substandard and falsified medical products are financially. And then on the ground, more than these 1 million deaths, if you take it, you put that in the context of Africa, it is 1 out of 2 products that are circulating, and those are in some categories. Category number 1 is falsified medicines. Number 2 is substandards, and number 3 is counterfeit medicines. So these things are really killing on the ground.
You've described the falsified medicines as a trade that kills silently. So why do you think this crisis still struggles to get the same political urgency as, say, drugs or armed trafficking or terrorism?
Let us check some data that are pushing people to go and to do these things. When they put money on guns or drugs, what they get back as profit, if you do the same in this area, then you multiply your profit by between 40 and 47%. When it comes to the risk you are taking legally, and then you can see that in average, in the world. When they catch somebody with drugs, it costs you at least, with a piece of drug, it costs you at least 2 years jail. You do the same with thousands of dollars of fake medicines, it just costs you 6 months jail. So here is a traffic that you earn more money and you take less risk. What do you do? So here is what they do. And now we have some data and some papers showcasing that there are also linked with all these civil wars you can see around the world, specifically in Africa, because the more the countries are destabilized, the better they circulate on the ground. So this is things that is really scary or preoccupating.
I guess in terms of what you just mentioned there, many people assume that the sale of falsified medicines is a marginal or informal issue. But how embedded would you say the falsified medicine trade is in terms of being integrated or seeping into some of the formal supply chains across Africa?
Well, there's a very important question. Mainly we talk about the normal formalized way of selling, so pharmaceutical industry, from some pharmaceutical industry to the pharmacies, to the hospital, to the health system. This is the official and standardized way of selling things. But you have also, let us say, mainly all the parallel system. And the parallel system, by definition, is very, very difficult to struggle because they are well organized and they are occupying almost all the ground. And if you know how our borders on the ground are organized, it is very difficult for any country to be sure that he can control its borders. So the parallel system that can enter in a country, enter in a system, enter in an informal market, but also the formal market. These things are really preoccupating for Africa. At the end of the day, what we can know for sure, it is that they are killing people, they are killing children, they are killing women. It is preoccupating.
From what you just described, this isn't just about bad actors on the margins. It's actually a systematic issue. So let's talk about the human cost of that failing system. From the work that you have done, what would you say are some of the most dangerous misconceptions people have about counterfeit medicines, especially within communities in Africa?
Guess what? One of the main victims are mother and child area in health system. I don't know if you are aware about what happened in Gambia. We had there a trial. Then it has been well known that several children has been killed by a syrup in 3 days. So it showcases that one of the victims mainly are children and mothers. But more dangerously, let us say, more preoccupating things is that now we have scientific information on one thing very important. It is the relationship between the use of these fake drugs and with our kidneys. The problem of the kidneys, if you put them with the level of our platforms where we welcome those people with kidneys problem, and then you will be really, really preoccupied because it is becoming more and more dangerous. My purpose is to say we should talk about it loudly and address this issue from Africa for Africa and to save lives on the ground.
As you mentioned, one of the most affected victims are mothers and children. So if we look at the type of drugs or medicines that people are taking, which ones would you say are the most affected? Is it antibiotics, antimalarials, or chronic disease medicines?
We can later on share the data, but antibiotics are mainly and anti-malaria due to one thing. It is, these people are just following what is the main issue for people on the ground. So mainly those are the most used and the most utilized on the ground. So they just want to make much more money. And how they make much more money is to convince them that it is cheaper and it is helping them. But the main thing is that they are killing them.
With some of the side effects and the devastating outcomes, what would you say are some of the issues caused in terms of fake medicine, in terms of eroding trust in health systems, doctors, and even legitimate pharmaceutical companies?
What I wanted to mention to you is that here is the thing. Africa is for a long time now trying to face and to struggle and to address this issue. Remember that there was a declaration of Abuja that was in 2021. The declaration says the following: African states, governments, should put at least 5% of each country GDP to strengthen health system. At least 15% of a governmental budget each year should be dedicated to health system sector. But the problem is that, as you know, the difficulties are in terms of finance are a really, really big issue. So from then to now, only South Africa succeeded to achieve these figures. That showcases that the more you are able to cover your internal health system, the better you can control at least the formal sector. So the less you control and the less you have the knowledge, the less you have the know-how, and the less you are well organized, the more these people can circulate and these people can hurt our population. Another thing to know is out of 54 countries, you have only 8 countries that achieve the level number 3 of the WHO maturity. That's why we are very, very concerned and preoccupied, and we are launching on March 2025 a PhD program to train some master's students, but it's mainly PhD program, 100% for Africans, to use a specific AI to help Africa to strengthen the supply chain, but to help Africa to recognize by using this specific AI to recognize what is falsified, or authentic medicines. There is a specific technology that has been invented recently in the most important incubator of AI in Paris. And we are launching this with the University of Sorbonne. And we hope that this is one of the initiatives that can help Africa to advocate, to promote, and to inform, to have a high level communication, and also to be able to strengthen the health system professionals on the ground.
Thank you for sharing that. At this point, I think listeners might be thinking, if fake medicines are so dangerous, why do people keep buying them? And that takes us into the economics, because one theme that keeps coming up repeatedly is the affordability. So when legitimate medicines are so expensive or unavailable, how do we realistically expect patients not to turn to street markets?
I think there is several things to be done. That is what we have been trying to do with the Lome initiative that we launched it January 2020, when we appointed Togo as a pilot of this program. And with Togo, we succeeded to build some things. Number one is to organize the country in around what we called an interministerial committee that gathered all the stakeholders, including the private sector, including all the pharmacists, the journalists, the judicial system. And then we succeeded to build what we call now, and you can find these things with WHO on the website of WHO, what we called a national plan against fake medicines. The other thing is that we are now trying to scale this battle. That's why we launched this PhD program, but also in the continental level, the African Union has launched a continental committee which is going to build the continental plan against fake medicines, and it has been launched on last July 2025. Well, to answer precisely to your question, I think from our perspective, the something to be done is number one, the communication. Someone can go and buy these things because he is not really aware about how dangerous it is. So the plan against fake medicines has three main principles. The number three of these principles is dedicated to the communication. Communication in local languages, communication in the villages, communication and communities, radios, communities, medias, on whatever it is to advocate, is to promote the idea that these things are killing. Number two, and you are right to mention that, people go and buy these because they think that in the formal market, the products are more costly. You know what? The more you are far from where the product is produced, the higher the price is due to the system of intermediaries. So they are right to say the products are expensive. But guess what? In some cases, because of the fact that those sellers of the fake medicines sell them by pieces. But when you gather all the pieces in a box, you realize that actually the box costs you more than what you can buy it in a normal pharmacy. So the problem is really, really very complicated because of the fact that the people who are doing this are very powerful, and they are definitely committed on corrupting people, on having access to some communities and having access to some influential possibility to have access to the market. And the problem is now, what we think is that the more the market is informed, the more people awareness will be higher and people will be probably willing to not buy these things.
So if we move from looking at the buyer to the seller, I know in countries like Congo, Brazzaville, informal medicine sellers are also part of the local economy. So how do we tackle this problem without ignoring people's livelihoods and also the economic integration?
You are definitely right to mention that, because the seller exists because there is a market. So what we think for sure is the more these people, the patients are informed, the more the patients are well informed, and the less you will have a market. That's why it is surprising that here is one thing that is killing this very important level of numbers of people, and we have less communication in this. At the whole period of COVID-19, actually, if you take the official figures in Africa, killed less than 3,000 people on the continent. It is amazing that these things is killing definitely much more people, and it is not on the front page of the communication of the medias, because of probably when you communicate in these things, you scare people and you're not selling your papers. So I think the civil society is one of the solutions to help to struggle the thing that why the association, the foundations on the ground, the journalists, specific journalists specialized on health, wherever it is, on the networks. The journalists are very, very, very important, are the key pillars to help the system to inform the client, to inform the patient, and then you can cut off the market from the ground.
I'd like to look closer at something you mentioned earlier. You highlighted how, falsified medicines move across borders, often exploiting some of the weak custom controls that we do see. With that in mind, how transnational would you say this trade is, and what does it mean for countries trying to solve this problem on their own instead of working collaboratively?
Wow, you are amazing, because this is one of the key points. We believe 100% that the collaboration at the supranational level, whether it is we can organize by region or in the continental level, it is crucial that we organize ourselves, because it is just, let us say, a dream to think that a single country can by itself succeed to fight efficiently this issue. Only the organization can help us. I mentioned that earlier, that the level of the know-how and also the equipment in terms of scientific equipment, you know that each country should have what we call a national quality control laboratory. But to have these, it is costly. It is costly and it takes time to train people at the high level. So actually, that's why you only have 8 countries out of 54 to achieve, to arrive at the level number 3 of maturity of WHO. So I think we should organize ourselves as countries, the international level, to organize ourselves, to train ourselves, to mutualize the know-how, the technology, and also to mutualize the supply chain system, to mutualize the warehouses. Why do we have time to time the problem of substandard medical product? Because let us mention the question of the temperature. It is very important to maintain the product in a normal temperature for a specific product. So all this is costly, and they need an international level of organization, of mutualization. But also, what you mentioned is very crucial and important. If you go on the ground, just see how large are some countries in terms of border. It is just no way. Well, if you take the current level of organization, there is no way to be able to control the borders. So those people will circulate. We need to organize the countries to mutualize and to share the informations, and to be able to map all the roads that are used by these people, to be able to share this information so that each country can be at least at the same level of information, and at least to be able to help each other.
Thank you for sharing that. As part of Africa's economic growth, we have seen an increase in global manufacturing hubs, international shipping routes, and free trade zones. Would you say that these are a help or a hindrance to enforcing efforts in Africa?
Yes, from my perspective, all these efforts are on the right direction, but it's not enough, because this system is very powerful, and they are very well organized, and as they are powerful, they have access to some technology as transportations, sharing informations. That's why I think that the multilateral organization between the countries, between the authorities, between the civil society, between the journalists, how they can share the informations, all these mutualization are very, very important to be able to face and to strike the battle.
That brings us nicely to the role of law and actual political will. You've been very vocal about the need for African states to ratify the Medicrime Convention. So what practical difference does this ratification actually make on the ground?
These things is very important because if we take the practical things we have been doing, it is, as I mentioned earlier, each country legislation should be upgraded at the level of the crime. And Medicrime is one of the tools that the international system have to be able to help those countries. That's why we are definitely engaged to help, and it is not easy because you have not only to sign the contract of Medicrime, but you have only to convince the parliamentarian to ratify it locally. So sometimes it takes times. And in some countries, it appears that it is not a priority. So, things are very complicated, and let us say, the local ecosystem is also complicated to be able to bring all these people together. What we started in Togo and going to do that in Senegal, and we are planning to do it maybe in Congo. It is we're working with the parliamentarians. In Togo, we had a session, a specific session on training the parliamentarians and on informing them and on how to help locally to revise and to upgrade the standards, the legislations, and to help people to be aware about how important it is to revise the legislation and to train the judiciary system, the judiciary stakeholders, professionals, so that they can not only have these revised standards and legislation, but they can be able to apply these correctly and normally at the level of the crime. So these things we started to do it, and the more we have the journalists covering these, the journalists helping, including the parliamentarians, to helping them to communicate with the people, to communicate with the professional, to communicate with all the stakeholders, some kind of, let us say, multiform battle to have.
So if we keep on the theme of law and regulation, through the Lome initiative, we've seen commitments to criminalize falsified medicines. But with that in mind, where would you say countries are still falling short with regards to things like legislation, enforcement, or even coordination?
Well, at the supranational level, that's why it is important for you guys and the medias to help us in terms of advocating and bringing awareness, because the more we are aware about it, the better it will be. This thing that I mentioned on the supranational level, which is bringing a new committee, a continental committee, which is going to work, it is started to work on a national and a continental plan of fighting against fake medicines that help, each country national regulatory agency, which help them in terms of organization, in terms of equipping them with tools, with standards, highlighting standards, revising standards, and sharing the know-how and supporting each other are very crucial. As I mentioned earlier, we are sure that a specific single country by its own, you can try to fight, but it is necessary that the trans-border system is tackled.
You touched on revising standards and also increasing people's know-how, but I was wondering, do we actually have the internal regulatory capacity, such as testing labs, inspectors, even post-market surveillance to carry out this work?
Let us take one example. As I mentioned earlier, out of 54 countries, you have 8 countries that reach the level of maturity number 3, and only one country, Francophone country, succeeded to do that. It is Senegal. And we are now in the business of having what we call reliance MOU between this country and some countries that are interested to share the experience, to share the capacity and the possibility that they can use the National Quality Control Laboratory of Senegal to help them. I think this is one of the cooperation more than the regional level that are very important to share the battle.
I guess despite these challenges, there are things that are working. So let's talk about solutions that go beyond, I guess, the theory. I know the foundation has supported pilot projects, including in Togo. So what have these pilots taught you about what actually works versus what looks good on paper?
Some action that we are proud of is to say, we realize is this national plan against fake medicines that are okay now, but in which one of the activities very important is this initiative with the parliamentarians that help the parliamentarians to be aware at the high level of the issue, and so that they can vote the budget accordingly, and then they can help each country to be well organized in terms of national regulatory agency, in which you have a national laboratory of quality control, so that you'll be able to authorize what is entering in the country by knowing exactly in terms of data what is entering in the country. But it needs the know-how, the knowledge to highlight and to upgrade all these to build capacity buildings on the ground. And then we're trying to scale these, and in terms of cooperation between countries. That's why I mentioned what we have been doing with the Senegalese regulatory agency, because they are at the level number 3 of maturity of WHO. So I think one thing to encourage is this cooperation in terms of reliance, to be able that this Senegalese regulatory agency can share, it can help, and can cooperate with all the countries that are willing to do so. So I think these things are very important. And then the other thing which is very important in terms of capacity building is how we all together collectively be able to train Africans and to bring to Africa, to make sure that we have a technology and know-how and skills transferred from Westerners to Africa. That's why we are launching this program. And well, those things are very, very important that we think. But mainly, what I'm convinced is that you people, journalists, you people on the business of communication, you people are very, 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 very important in this battle, because the more we know, the more we are aware, the more we advocate, the more we promote, the better things will be and on the field, on the ground.
You touched on something quite important, which is being organised, which requires collaboration between pharma companies, logistics, customs, and governments. If we look specifically at governments, if African governments were to prioritise just 2 or 3 actions to stop falsified medicines, what would you recommend they should look at or prioritise?
I would say, number one, to reinforce the know-how, the capacity buildings, and the communication. Communication in the villages, communication in local languages, communication in our cities, our suburbs, our communication in our markets, communication in the hospitals and the maternities, to really, really bring on the ground the necessary awareness.
Also, if we look at business leaders, policymakers, and just everyday consumers listening to this episode, what would you say is one action each group can take to stop falsified medicines from reaching the market?
Once more, I will repeat myself in this issue because I believe in that. If they can help to communicate, to blow up this issue, because look, how is it possible that the COVID-19 has succeeded to block countries, to block ecosystems, airports, because of the communication, because people were aware about the danger. And then, as the people on the ground, generally the people were aware about the danger, then the decision makers made decisions, real decisions and practical decisions to save lives. The more the people will be aware about the issue on the ground, I think the more we will be able to involve the decision makers. And also, these people, whether they are private, whether they are industry, whether they are whatever they are acting as economy or ecosystem, the more they will join to help us to train, to help us to organize, to help us to revise the legislation, to accompany the parliamentarians, to strengthen the professionals of health system, the pharmacists, everybody. The more they will join this civil society battle, I think the larger the success will be.
If we look closer to home and look to the future, what specific role do you see the Brazzaville Foundation playing in building more resilient, trusted, and also secure medicine markets across the continent in the next 5 to 10 years?
Brilliant question. We have long-term vision, but even the longer journey started by the first step. So in 2026, 2027, here is, if I can resume or let us summarize our main issues. Number one, we are in a business of bringing to Africa, and I need you specifically, the media, we succeeded to convince Johns Hopkins University in DC, who is the holder of a conference called Be Safe. And this conference gathered the best specialists of the question of the fight against fake medicines in the world. And here is the deal now. Because of the fact that the main victims are in Africa, the largest, let us say, the most important figures, numbers of victims are in Africa, we succeeded to agree that the best place to organize this yearly conference would be in Africa. So we agreed now, they gave the Brazzaville Foundation this opportunity that we will organize the 2026 Be Safe on the continent. Better than that, we agreed with them that the Secretariat of Be Safe will be settled in Africa. So those things are very, very, very important for us. Number two is the question, important, crucial and important question of the capacity building of the professionals on the ground. And from these capacity buildings, this PhD program that I talked about, another thing which is related to that, how together we will be able to build the first database of what is circulating as authentic medicines in the ground, what the continent need as authentic medicines, and then to be able to build and to know, to have the real knowledge of what is circulating as fake, substandard, or falsified medicines on the ground. The more we know about it, the better we will be able to fight it. So this is one of the main projects we have. And another project we are trying to do is, since the very beginning of the company like Coca-Cola, they succeed up to now to bring to a specific village, the farthest village in Africa, they can bring you a authentic Coca-Cola. How humanity is not able to guarantee to this lady who is going to deliver that we can guarantee her a authentic medicines. That's why we are now organizing, trying to launch a specific fund so that we can have a kind of seed money to help the continent to raise a local pharmaceutical industry, to organize the warehouses, the supply chain, to be able to map all the roads used by these people who are selling these rubbish things on the ground. Well, the knowledge is very important, but it is also costly. That's why we think about to launch this specific fund. We're working about it, and we need your help. Very, very important help. Well, here is what I can share with you. But I can share with you also another thing which is less strategic than all the three things I've talked about, but it's very practical. Actually, we did launch a program of bringing to Africa some materials to equip our maternities, our hospitals, that is simple, such as gloves, such as hospital beds, medical beds. I don't know if you used to visit some maternities. There is some countries, if you visit the maternities, then you will be probably crying because of the standards you can find there. And in some cases, women need to bring their own staff to be able to deliver. So we are bringing some materials. I can share some pictures. What is important? I would love, for example, you to be able to cover one of the ceremony where we're delivering some material. We have 40 tons, and Dakar hospital called Hôpital Principal that arrived already in last December. We have 120 tons that are arrived in Dakar, 160 tons in Togo. That is the first step. We are trying to do something to at least to showcase that if we are well organized, maybe some maternities will be able to equip them.
Fantastic. I look forward to that, and I'd be very interested in helping to highlight what is happening on the ground.
Quote of the week.
As people, we often have quotes, mantras, African proverbs, or affirmations that keep us going when times are good or when times are challenging. Do you have one that you can share with us today?
I love the two things, and I used to say to share this. Lonely, I can go fast, but together we will go farther.
Perfect.
Number two, there is a Chinese philosopher, Confucius said, each one of us has two lives. Second life starts the day you are aware about that you only have one life. Because from that date, you will orientate or reorientate all your energy of about what would be putting a sense of your life, of what will be helping you to think about the real mission that you have on earth. What I can summarize to say, let us together think about what is the legacy that we are aiming to do. From my perspective, it is to say, the day I quit this world, what would be my achievement? It would be at least how did I do to save lives, specifically in the sector of mother and child system. And then I can conclude in what I believe. I know for sure that one of the best impact what we should have is how to strengthen our own people so that they can be able to face and to struggle by themselves all these big issues, all these big dramas, because it is really, really dramatic on the ground.
Thank you for sharing that, Foulo. It's been an absolute pleasure to have you on the podcast. I think today's conversation makes me think, or makes one thing clear, that trade in falsified medicine is not just a side issue. It's something that is very systemic. It's a systemic failure that sits at the heart of health, trade, and governance across the continent. And in order for us to tackle it, it needs more than just seizures or statements. It demands stronger institutions. Also, as we said earlier, that coordinated enforcement and also a trusted supply chain. And we can't forget the sustained and ongoing political will, because without all of those elements or factors coming together, we won't really achieve much.
Thank you very much for giving me this opportunity. And I know for sure you people are definitely the best allies of this battle.
Thank you to everyone who has listened and stayed tuned to the podcast. If you've enjoyed this episode, please subscribe, share, or tell a friend about it. You can also rate, review us in Apple Podcast or wherever you download your podcast. Thank you, and see you next week for the Unlocking Africa podcast.